Part 7. Module 6. Continued. Module 6. Follow-up and cross-selling methods. Continued. Continuing from cross-selling. Every employee you enroll in GoMD USA, and even the business owner, is a potential client for other insurance products you sell. You've established trust by helping them with a health benefit. Here's how to ethically leverage that relationship. The key points of cross-selling were covered above. Remember to always focus on being helpful and consultative, not just selling. Part 8. Module 7. Scenario-based examples and role plays. Module 7. Scenario-based examples and role plays. In this module, we bring it all together with scenario-based examples. These are sample situations you might encounter while selling the GoMD USA plan, with guidance on how to handle each. Practicing these scenarios, even role-playing with a colleague or friend, will build your confidence for real-world interactions. 7.1. Engaging the gatekeeper. Needs-based hooks. Sometimes a gatekeeper won't put you through to the owner without a compelling reason. Tapping into personal needs or interests can be highly effective. Here are a few scenarios and how you could respond in each. Gatekeeper with chronic pain. If during small talk a gatekeeper mentions having back pain or you notice them wincing, use that info. You. I'm sorry to hear about your back pain. You know, one cool thing about the plan I'm showing the boss is it includes pain management consultations. Our doctors can evaluate chronic pain via telehealth and even prescribe treatments or therapy, all at no cost. It's been life-changing for some folks. I really think the team here, including you, could benefit from it. Effect. You personalize the plan's value to the gatekeeper's situation. Now they have a reason to be interested and to help champion this to the owner. Gatekeeper stressed or interested in mental health. Maybe the gatekeeper casually says, "It's been crazy here, I'm so stressed." Or you notice pamphlets about mental health in the lobby. Pivot to that. You. These days, stress levels are high for everyone. Part of our plan includes mental health support. Employees can talk to a therapist or get anxiety, depression meds through our telehealth service with no copays, totally confidential. A lot of employees really appreciate that benefit. Effect. You've positioned the plan as caring about well-being, not just physical health. A gatekeeper who's stressed might personally want that benefit, making them more receptive to you. Gatekeeper mentions skincare or cosmetic interests. Perhaps the gatekeeper compliments your skin or mentions a dermatology appointment. You. Funny enough, our telehealth service even covers skincare consultations. People use it for acne treatment, eczema, even advice on anti-aging, and they get prescriptions for creams at no cost. It's not something most benefits include, so employees here would probably love it. Effect. Highlighting a nice-to-have feature, like dermatology, can excite someone if it aligns with their interests. It makes the plan sound even more comprehensive and unique. Weight loss or wellness chat. You see a Biggest Loser office weight loss challenge poster? Or someone mentions they're trying to lose weight. You. We actually have a lot of folks using our plan's weight loss program. They consult with a doctor about diet and exercise, and if appropriate, the doc can prescribe weight loss meds. Again, all included at no extra cost. It's been super helpful for employees looking to get healthier. Effect. Now the gatekeeper, or whoever hears this, knows the plan can help with a goal they care about. It's another hook that shows this benefit isn't just generic, it touches on things people actively want. Hair loss concern. This one is a bit sensitive. If context allows, say the gatekeeper is joking about their receding hairline or you have good rapport, you can mention it. You. Believe it or not, our plan even covers things like hair loss treatment. If someone wants a prescription for hair growth, they can consult a doctor and get it delivered without spending a dime. Not many benefits cover that kind of thing. Effect. This shows how comprehensive the plan is, covering even sensitive or vanity issues. If the gatekeeper has that concern, you just hit a personal pain point in a helpful way. In all these gatekeeper scenarios, the idea is to listen for clues or observe context, then highlight a specific feature of the plan that might resonate personally with them. The gatekeeper then becomes more likely to champion your cause to the owner, or at least allow you through because they see personal value. Be tactful. You don't want to seem intrusive or assumptive. A light, "By the way, did you know so?" approach works wonders. 7.2. Addressing owner pain points, sample dialogues. Business owners typically care about the bottom line and their employees' performance. Let's look at scenarios targeting common pain points and how you might respond. Pain point. High hiring costs. Scenario, a restaurant owner says, "It's so hard to find and keep good people. They often leave after a few months." Your approach? First empathize, then connect the plan as a solution to turnover. Agent script. I hear this from many business owners. Hiring and training new staff constantly is expensive and exhausting. One thing that motivates employees to stay is feeling that their employer cares about them. Even if you can't afford full insurance, offering this health plan shows you're investing in their well-being. It could give you an edge over the restaurant down the street. For just $20 a month per person, you might reduce your turnover and save thousands in rehiring costs. It basically pays for itself if it helps you keep even 1 or 2 employees longer. Result? You reframe $20 a month as an investment to save on hiring costs, not just an expense. Pain point, retention and morale scenario. A salon owner says, "My stylists sometimes leave to work at places with more benefits. I can't afford big benefits like a large salon can." Your approach. Show how even a small benefit can level the playing field and boost loyalty. Agent script. Retention is tough, especially when bigger companies dangle benefits. But here's a secret. Employees often value any health benefit, sometimes more than a small pay raise. If you tell your stylists, "I care about you and your family's health, so I'm giving you a plan where you never have to pay to see a doctor or get prescriptions," that builds huge loyalty. It's something the salon down the road likely doesn't offer. Your stylists might think twice about leaving when they realize they'd lose that free health coverage. And for you, it's a small monthly expense per stylist, but the message it sends is huge for morale. Painting the plan as a unique perk that competitors lack can spark the owner's competitive spirit to implement it.